Hello, my name is Kaleigh Hall. I am an Aspen University nursing student, and I am here to discuss my Module 4 video assignment with you. There are so many individuals that are struggling with addiction and different mental health disorders. It is important as healthcare providers that we learn and acknowledge the signs and symptoms of different drug withdrawals and the severity of them. It is so important that we treat them with respect and guide them to a healthier life by giving them resources and support that they might not know are available to them. In this video, I will discuss a scenario of a patient and the different treatments that could be used on her. I will also discuss the need for mental health awareness to be spread and why insurance companies aren't doing enough. The initial examination of the patient. Based on the first impressions of this patient's actions and appearance, it would be suspected that she's suffering from alcohol withdrawals. Alcohol withdrawals can vary between individuals and the amount of alcohol they consume on a daily basis and how long they have not consumed alcohol. Some symptoms can include anxiety, shaking, nausea, vomiting, disorientation, tremors, and seizures. Based on these symptoms listed above and stating that she needs another bottle, this is what I logically assumed that she's struggling with. Short-term and long-term health risks. Based on the assumptions that this patient is suffering from alcohol withdrawals, there are many different short and long-term risks that she could suffer from. Some of the short-term effects that would be expected that this patient will be suffering from are drowsiness, GI problems, headaches, breathing difficulties, distorted vision or hearing, anemia, unconsciousness, memory lapse, and even comas. The severity of these symptoms will vary on an individual basis and will be affected by how much the patient is consuming. The long-term symptoms and health risks that could be assumed that this patient is suffering from will also vary on how much alcohol she's consuming daily and the quantity she's consuming it. Some of the long-term symptoms are alcohol poisoning, high blood pressure, strokes, liver disease or liver failure, nerve damage, permanent brain damage, ulcers, gastritis, malnutrition, and cancers of the mouth or throat. These health risks are very concerning, and individuals suffering with alcoholism might not know the extent of the damage that they are causing their bodies. Therefore, educating our patients is so important so they can feel empowered to make healthier life choices and improve their lives. The causes for the medical condition. For this patient, it states in the scenario that she is suffering with severe handshaking or tremors. She's disoriented and combative. These are all symptoms that were discussed above and are common with alcohol withdrawals. Trembling occurs when the brain gets accustomed to lower levels of stimulation due to frequent alcohol consumption, and when discontinued, the brain gets flooded with hyperactivity, resulting in shaking. The patient is also feeling very ill because of the withdrawal symptoms she's experiencing, which can cause her disorientation and even explain why she's being combative. Since we do not know the extent of her condition or the state of her sobriety, she could also somewhat be intoxicated still, and these could be elevating the symptoms that she's experiencing. Assessment needs for the patient. There are many different assessments that need to be done on this patient. Her cognitive abilities need to be assessed. It would also be important to assess her emotional status and any family members that we could contact to come and help her in her new healthy life, hopefully. Her motivation of fixing her condition should be assessed so resources can be given to her and lead her to a path of health and wellness. Her medical history should be evaluated, including her past conditions, medications she's taking or has taken in the past, how often she's consuming alcohol, any medical allergies or intolerances, and how much alcohol she's consuming on a daily basis. She should be assessed for any physical limitations and her mobility. Her nutritional status and self-care abilities could also be assessed. These assessments would be very important in treating her and can give us information and tools to give her the best care possible. It's important that we get as much of the whole picture as possible when treating this patient so we don't already harm her in her fragile condition. If she's already prescribed medication that she's not taking, or if she's prescribed medication that we would just be giving her a double prescription of. None of these things are going to be helpful to her. So we need to get as much of her past medical history as we can to really see how we can help this woman. For mental illness treatment methods. Mental illness management can be very intricate process. There are people suffering with a variety of symptoms that are often diagnosed with broad disorders that can take months to find suitable treatments for. Some individuals do not even know that they're being affected by a mental illness. This can be very costly and time-consuming for the individual. Since this process is so complicated, it's important to encourage patients to continue their treatments and to be vocal about how they're feeling with their providers. It is also important that individuals are seeking a consistent doctor so their progress can be monitored and documented. There are tons of different therapies and treatments that are being used to treat mental health disorders. Unfortunately, patients around the country are still struggling to get access and treatment for their mental health care. Insurance support is still very low for individuals suffering with mental health disorders. A decade ago, Congress passed the Mental Health and Addiction Equality Act, which was supposed to make mental health and substance abuse treatment just as accessible as any other type of care needed. However, patients all over the U.S. are still struggling to get coverage for these serious conditions. There is a very high proportion of out-of-network behavioral care. This means that patients are suffering with mental health or substance abuse problems and are facing much higher out-of-pocket costs than someone with a physical health condition. This can make treatments unaffordable and unmanageable for people suffering with these conditions. One of the most common reasons that people are not getting mental health treatment is the cost of it. We need to be providing more available and realistic resources for these individuals. Mental health needs to be considered just as a serious problem as physical health. This change needs to be made so more people can get the coverage that they deserve. The patient discussed above needs many different treatments and resources to get on a path of health. It is very disheartening to think that she's alone and needing help but might not know how to get it. Therefore, our job is so important as healthcare providers. We cannot just look at the current state of a patient, but we also must look at the patient's life and how we can best treat them. Therefore, it's important not to just discuss their physical health, but also their mental well-being. It's important that in this climate, with mental health being discussed and validated, that we are providing coverage for those in need. It is essential that we are making changes to provide care and coverage for those in need and acknowledging mental health just like we do physical health. By empowering patients to seek help and get the care that they need, it's improving not only their mental, but their physical health. They're so tied together, we need to make sure that these patients are able to get the mental health care they need, just as they were needing physical health care. If someone needs to be seen by a psychiatrist or a psychologist to get help for depression or anxiety, that should be looked at just the same as if someone needs to see their doctor because they have the cold or strep throat. Unfortunately, that's not how it's seen in today's society, mainly by insurance companies. We have seen a switch in media and stuff like that, releasing some of the stigma that people do suffer with mental health disorders. However, we haven't really seen that change in the economic standpoint. So a lot of these patients are suffering and can't get the help that they need. This is a change that needs to be made in our society so patients can be overall healthy, because people's mental health is just as important as their physical health. Thank you.